Hi, I'm Dr. James Machino, and I'm here to tell you about a seminar I teach called Nutritional Assessment and Management of Complicated Pathologies. Now, what this refers to is that very often in clinical practice, patients come in with a specific health issue. They want to lose weight, or they have high cholesterol, or they're a diabetic. And then during the intake questionnaire, you start to realize the person also has a kidney condition, or there's a liver problem, or they also have had digestive tract issues, or they may have symptoms or signs that suggest there might be an anemia present. And when this occurs, this is very tricky and delicate territory to manage a person's health when they're having one of these possible problems in the background. Changes the whole landscape of the treatment. So to get the diagnosis right and the management right, you have to have the right information. So many practitioners that I've met I'll have a certain level of insecurity about these issues. In other words, the pathophysiology, what actually is going wrong, the health disorders that actually create chronic renal failure, whether it's mild, moderate, and severe, and what you actually do in that situation. Or in liver disease, if there's some kind of chronic hepatitis, or there's cirrhosis is already there, or there's been alcohol-induced damage to the liver, or drug-induced damage to the liver, or what we called non-alcoholic steatohepatitis, an inflammatory liver condition that's not uncommon in a diabetic, someone who's overweight, someone who eats a high-fat diet over a long period of time. And then digestive tract problems, gastroesophageal reflux disease. Is it present? Is it not present? What about ulcers? What do you do then? Gastritis, inflammatory bowel diseases. How you coordinate your therapy around when people have these problems is extremely important. And the difference between nutritional anemias and non-nutritional anemias. A lot of practitioners struggle in this area a little bit. The truth is that the wrong recommendations in these cases can actually cause the patient a lot of trouble and a lot of damage and liability problems for the practitioner. So you really have to know what you're doing. These are very fragile conditions that can be easily made worse with the wrong advice. On the other hand, the right advice can improve these health conditions immensely, and sometimes reversing the pathology in many cases, so the person's overall health is significantly better and can do things that drugs can't do using natural interventions. So the seminar that I teach will demystify all these pathologies for you and will help ensure that you use the best practices available in advising clients and patients that have these problems while protecting yourself from liability issues. The seminar also includes a simplified approach at looking at the standard blood work that a doctor would order during a physical examination. That blood work is called the CBC, or the complete blood count. It'll help you just get a quick view of how to interpret those blood findings if the patient brings in a copy. So you'll be able to understand some of these pathologies and also deal with other problems that you might see and identify related, say, to cholesterol or triglycerides or glucose or a high CRP or uric acid. Just get a quick review of what all of that means and what to do when you see certain things. So the seminar is a very important seminar for all health practitioners, as these complicated issues around kidney and liver and digestive issues and potential anemias are so prevalent in our society. The right nutrition advice and the right protocol can have a very positive impact, and so these people need your help because standard medical treatment doesn't address it completely, and the wrong approach can actually be severely injurious to the patient, and so you have to know what not to do. So as with all my programs, the course notes are included. I think it's a very important seminar. I thank you so much for watching.